According to the Department of Health, cardiovascular disease or CVD is among the top killers in the Philippines. Worldwide, it claims an estimated 17.7 million people, representing 31% of all global deaths. By the year 2020, it will claim about 25 million deaths each year, becoming the world's leading cause of death and disability. Symptomatic aortic valve stenosis, or AS, when left untreated, has a lower survival compared to some of the most common cancers that have spread throughout the body. Patients with severe AS and who experience heart failure have a reported 3% survival rate at 5 years. Symptoms associated with AS include chest pain or heaviness or angina, fatigue, shortness of breath on exertion or at rest, fainting or dizziness, and or heart failure, which may be associated with leg swelling, marked fatigue, as well as shortness of breath, functional limitation, and even inability to lie flat in bed. The condition can range from mild to severe. The St. Luke's Global Cities Heart Institute launched its Center for Structural Heart and Vascular Diseases in order to ensure that patients with complex valvular and vascular diseases receive the most advanced and effective treatments available. Prior to the introduction of minimally invasive techniques and options, patients with severe symptomatic AS had very limited options. They either underwent open heart surgery or aortic valve replacement, or SAVR, or in the worst case scenario, did not undergo surgery at all because of the potentially life-threatening risks associated with the surgery. The St. Luke's Global City Center for Structural Heart and Vascular Diseases is committed to fighting against the rising numbers of death and disabilities caused by cardiovascular diseases. It is what propelled a team of St. Luke's physicians to perform the first Philippine transcatheter aortic valve replacement, or TAVR, in 2012. Since then, the team has performed over 145 TAVR procedures with a procedural success rate of 98%. This success rate matches the reported outcomes from some of the best institutions in the world. The entire valve deployment procedure lasts an average of 45 minutes, and some patients don't even need general anesthesia or surgical cuts. The procedure is most commonly performed via the groin arteries, which can be accessed using a small incision at the groin area, or using special closure devices without any cuts. The valve, which is loaded on the catheter delivery system, is advanced from the groin and positioned at the narrowed aortic valve under X-ray and ultrasound guidance. The replacement valve is then deployed and the old diseased valve is pushed aside. The new heart valve allows more efficient and unobstructed flow from the main pumping chamber or left ventricle. At the end of the procedure, the surgical cut and access is then stitched up and closed. The recovery is usually rapid, with the patient able to walk within a day or 24 hours, and are often discharged after an average of 3 to 4 days in the hospital. Compared to open heart valve surgery, or SAVR, most TAVR patients in general are implanted with larger valves. This provides patients with bigger, more efficient valves, enabling them to recover faster and resume their normal activities over a shorter period of time. At St. Luke's Global City, the procedure is carried out by a dedicated heart team headed by Dr. Enrique Posas and Dr. Estanislao de Castro. The heart team may also be composed of interventional cardiologists, clinical cardiologists, cardiac anesthesiologists, cardiothoracic surgeons, and cardiac imaging specialists. These teams are complemented by highly trained cath lab and nursing staff designed to ensure the best care and patient outcomes. Today, St. Luke's Medical Center Global City and its team of dedicated specialists has become one of the most experienced centers for TAVR in the Southeast Asia region, with outcomes that match those reported from the best hospitals in the world. The Center for Structural Heart and Vascular Diseases ensures to pursue the advancement of medical care, expansion of medical knowledge, training, and introduction of the newest technologies designed to treat and prevent the rising number of deaths and CVD-related disabilities in the Philippines.